Dentists have read it. How can you tell if a client viciously brushed their teeth for minutes straight before an appointment?
I think people are missing the OP's actual question. I think OP meant how can you tell if they are a regular brusher versus someone who doesn't brush often, but just brushed extra long and hard before coming to see you. At least that's how I interpreted it.
Yes, and a nice brush floss before your appointment is appreciated. Eating a tuna sandwich in the waiting room is not.
Is brushing your teeth before the dentist not a thing everyone does? I'd rather not go in there with potentially bad breath or food in my teeth.
Dentists probably know because your gums are sending out an SOS signal and your toothbrush is. Filing for workers' compensation due to overwork.
I'm a dental assistant and I can definitely tell. At first, I was blessed because most of the patients' mouths was clean. But when the first and clean one came, it was bad. Food between teeth, smell. Some people have food stuck on their dentures. Partials. So if you want to be nice to your dentist, or even the assistants, please brush your teeth before coming, or at least rinse it with water if you don't have anything else. Thank you.
Teeth, gums and the oral cavity tell a story. I can generally tell if you come from a poor or rich family how much sugar you consume. If you smoke, vape, drink or take drugs. If you are pre-diabetic or diabetic. If you are highly stressed, different mental and systemic illnesses can be seen also. Obviously, how often you brush and floss. There are many other things that dental practitioners will know about you without you saying a word.
I've once apologized to my dentist that it's been a few hours since I've brushed my teeth. She just told me, I can't believe how many don't even bother brushing their teeth beforehand.
If you don't usually brush your teeth twice a day, your gums will be bleeding quite a bit. And if you do brush regularly, then from the fresh minty smell and lack of plaque and food pieces, it's appreciated. Just don't scrub too hard or you'll be sore and do damage to your gums.
Sure, the signs of aggressive brushing right before an appointment are typically bleeding gums, inflamed gum lines, and abrasion patterns on the teeth that are not characteristic of regular, gentle brushing.
Your gums gushing blood from just the sight of floss is quite telling.
This post brought up very vivid memories of my mom picking me up from school to take me to the dentist, handing me my toothbrush that was already wet with some toothpaste on it, and me frantically brushing my teeth and spitting out the window because we were always running, late to things.
Dentist here. Gingivitis takes about 2 weeks of diligent home care to go away. Brushing and flossing right before your appointment isn't enough time for the inflammation to resolve.
Anyone who doesn't brush their teeth before going to the dentist is an animal.
Everybody should also take a shower before seeing your doc for an ass balls bag examination too.